Really quickly before we start, I just want to introduce myself. My name's Emma. I'm from the Unova Center, and I'm going to help facilitate today's Q&A. We have some questions that were submitted before the event, which we can start with. But if you have a question that you'd like to ask us, please just pop it in the chat box, and I can read it out loud for you. For those of you who are new to either Unova or RMA, I also wanted to let you know a little bit about us. RMA of New York are leaders in state-of-the-art reproductive medicine. Their fertility clinic is led by an integrated team of doctors and scientists with extensive experience in fertility testing, IVF, egg freezing, and LGBTQ. They are currently offering virtual consultations and have recently opened their doors for fertility procedures. The Unova Center is an acupuncture and Chinese medicine clinic based in New York City. We specialize in fertility, women's health, and reproductive care. As of recently, we've moved our practice online and have been offering virtual consultations to support our patients, and we're opening our clinical doors next week. I'm going to pass this over to Dr. Sikhan of RMA and Dr. Blake Way, founder of the Unova Center, to introduce themselves to you, and then we can get started.
Hi, everyone.
Well, thank you. Hi, it's lovely to see you, Lucky, and it's lovely to see you all in the chat room. Perhaps you could introduce yourself a little bit, Lucky, for the people who are Unova community and don't know you.
Sounds great. So my name is Lucky Sikhan. I am one of the physicians at Reproductive Medicine Associates of New York, or RMA New York. And I personally am based at our Midtown East location and our Soho office. We have 6 different offices throughout different parts of the city. We're quite a high volume clinical practice, and we treat a wide variety of reproductive issues, namely infertility, but we also do a lot of fertility preservation, whether it be egg or embryo freezing. We treat different disorders of ovulation, so women who aren't necessarily interested in trying to conceive but have irregular periods, so things like PCOS, even menopause. And we do a lot of reproductive surgeries as well, and we work really closely with Unova. We've had a long-standing relationship with Unova and love the work that they do because they're able to help all facets of women's reproductive health. So any challenge that our patients are up against, we like to take a multidisciplinary approach and loop them in.
Well, thank you. And Lucky is a lovely doctor. I have to tell you, she's awesome. I'm Jill Blakeway. I'm the founder of Unova. I've been a practitioner of Chinese medicine for over 20 years, and fertility is one of my major focuses. I wrote a book back in 2009, which is so long ago now, called Making Babies, a 3-month program for maximum fertility. And I did that with a fertility doctor. I've always believed that patients do best when we all do what Lucky and I are doing at the moment, pool our brains and collaborate. I have just come off book tour for my 3rd book, which was a bit of a departure. It's called Energy Medicine, The Science and Mystery of Healing. And it's about all the prompts that prompt people to heal themselves. And fertility medicine really was my introduction to that idea that your body has an intelligence. It keeps coming back into balance. People always ask me, what's chi? And chi really is your body's intelligence. And in your reproductive system, your body has to be minutely intelligent. It has to synchronize everything. And I think that's why Chinese medicine is so helpful for fertility. And I know we had questions from people at home, but we do have one in the chat. And I thought we might start there. And then Emma has some questions from people from our Instagram. Stacy wanted to know, how important is diet really? And I think that's a really good question. I'll start, then I'm going to hand it to Lucky, but I'm going to say it's important, but don't be obsessed by it. The people I find have trouble getting pregnant are usually missing a nutrient. Yeah. So sometimes the vegans, if they're not really good about getting protein, have trouble. Likewise, the very low fat dieters have trouble. But if you follow a basically healthy diet with lots of colorful fruits and veg and some good quality protein and some healthy fats, that's good enough. And I think my experience having done this for 20 years is that people get extremely worried that that they're going to do something wrong with their diet, and that's going to stop them from getting pregnant. And so I want to say, and I think that's what that really is in your question, is do I have to be on some draconian fertility diet? And the answer is no. Just make sure you get a broad range of nutrients. What about you, Lucky? What do you think?
So I agree with everything you said. I think that question is something that I get asked so often, because all of us are, trying to gain control over the situation. And we want to know that we're doing everything in our power, anything that we can control to optimize our fertility. We want to be able to do it. And I think, there is something to be said for having a healthy diet. Food is medicine, right? And it affects all aspects of your health. And even if we can't study it in a very clean way, we know common sense would dictate that your diet can impact your fertility and your overall reproductive health. I agree with everything you said about keeping it moderate. Anytime you do anything extreme, you are threatening the balance that is necessary in your nutrition. So I think it's important to consult with professionals, especially if you're interested in getting pregnant or you're already pregnant, before trying any sort of new fad diet or something that's really overly restrictive. There's two ends of the spectrum: not enough calories or nutrition, or having an excess of calories, or having processed foods, or things that are high in trans fats. The studies largely show that there may be a trend towards increased success with treatment, or even increased natural fertility, when you adapt as close as possible to a Mediterranean style diet. And that's basic common sense, right? Lots of leafy green vegetables and fruits, nuts, seeds, sources of good fat like avocado. And if you're going to consume meat, then lean meats, and trying to stay away from red meat.
It's interesting, as you talk, I'm thinking there was actually some research that was done by a colleague of mine, Dr. Lee Hollander, that looked at whole systems Chinese medicine in the run-up to IVF. And what that means is dietary advice, lifestyle advice, herbs, acupuncture. And it was a meta-analysis of thousands of patients who'd gone through IVF. And what they found was giving acupuncture around transfer, embryo transfer, was helpful. It increased fertility, it increased live births. But the thing that made the most enormous difference was the whole systems Chinese medicine for the 3 months before. And what I think that was that the acupuncturists, practitioners of Chinese medicine like myself, were coaching their patients on diet and lifestyle. And it was like a little fertility boot camp ahead of their IVF. And it just shows that the healthier you are going into IVF, the better your body responds. And of course, the healthier your pregnancy is going to be too. So that's the importance of diet, Stacey. What about your next question, Emma?
That was super interesting. We have another question that someone from our Instagram asked, which was, what other things besides diet can help increase my chances of having a successful transfer?
Do you want to go first, Lucky?
Sure. So anything that's good for your overall health is going to optimize you for the transfer and for the pregnancy that lies ahead. So, if you're not someone that exercises regularly, this would be a good time to start in the lead up to a transfer and pregnancy. And it's something you should continue once you are pregnant. Exercise has been shown to be associated with better pregnancy outcomes, lower risks of high blood pressure, diabetes in pregnancy, and even promotes your likelihood of having a successful vaginal delivery. So I think exercise is a really key component. And, the next question I get asked is, what should I be doing? Having some element of cardiovascular exercise for at least 30 minutes a day, 3 to 4 times a week. I would say that you would see major benefits. And I also think mentally it's going to help you get through the process of the transfer. It helps you deal with stress and anxiety, and there can be a lot of that during the waiting game while you're waiting for your results and for some of those early pregnancy tests and scans to go well. Besides that, I think trying to adapt a cleaner lifestyle, and these aren't necessarily things that are going to have tangible effects, and they're not easy exposures to study and have published data on. but we have a lot of information coming out about toxins in our environment. We call them endocrine disruptors because there are a lot of chemicals in plastics, and they're found in common household items, in a lot of cosmetics, believe it or not, and beauty products, where they actually mimic the structure of some hormones, and they can actually stimulate some of the receptors in our body and have hormonal-like effects. And that can be additive over time. So I think really being mindful about what we're putting in our bodies and on our bodies and what we're exposing ourselves to in our homes is only going to serve you well and optimize your chance of not only a successful transfer, but a healthy pregnancy moving forward.
Well, I agree with absolutely all of that. And I do think that I think you're so right about endocrine disruptors. Now is the time to go through your beauty closet. And there's so many really good products that are natural on the market these days that are, there's nice lipsticks. There didn't used to be. There was only toxic lipsticks. But it's hard, as Lucky said, to take out all the variables to show the effect of endocrine disruptors on women who are trying to get pregnant, but it's common sense that they must be. And we do see it in women a little bit older when they're perimenopausal with a sort of estrogen dominance that causes all sorts of perimenopausal hormonal problems. And when we take them off their toxic chemicals, household cleaners being another one, it's amazing how much better they do. So, my advice is don't be obsessive. You can, but I always think with people trying to get pregnant that you have to do something you can do for the long haul, because it sometimes takes a few months to get pregnant, and anything too hard to do is too hard for you to sustain. So, you can have a drink or two, but moderate drinking is a good idea. Keeping your coffee, which makes you somewhat acidic, under control, like one relatively normal cup rather than a bucket every day. We're not all going to Starbucks at the moment. That must have helped. We're all having normal cups of coffee at home rather than ventis and things. In my book, Making Babies, there's a 3-month program that Dr. David and I really did design to help people get in the best possible state to get pregnant. And every now and again, I go to Amazon on a bad day. I go to Amazon to reassure myself. And, hundreds and hundreds of people have now written, I did what they said in the book and I got pregnant. So it shows that even people who've struggled, it shows that lifestyle adaptations, simple ones, can make a big difference.
Thank you for that question. Caffeine is a huge one. Yes. I find a lot of patients, a lot of individuals and couples will overly restrict caffeine, and they'll have caffeine withdrawal headaches and feel terrible. And I tell them it's okay to have 1 cup. And there is actual data, and this is endorsed by the American College of Obstetricians and Gynecologists. They recommend keeping your caffeine intake to less than 300 milligrams per day. One Americano at Starbucks, speaking of which, is about 150 milligrams of caffeine. So that gives you an idea of scale. It's okay to have a cup of coffee in the morning, but having an excess of 3 or 4, that's when you can start to get into trouble. And especially around the time of transfer, I wouldn't advise that. I wanted to ask Jill a question. Do you have a standard regimen for someone who's going into their first embryo transfer, but they want to use Chinese medicine and acupuncture alongside the transfer? What is kind of like the standard approach you would take?
I'm glad you asked, actually, because there's a lot of sort of mythology out there and people start to get very worried about when they should time their acupuncture. So what we do when someone's going through IVF is, in a perfect world, if we have the chance, we'd like to see you beforehand. Preferably 3 months, but you know what? We'll take however many weeks we can get and try and get you into a good position to do it. And then when you take your stimulating drugs, your follicle stimulating drugs, we like to see you twice a week for acupuncture. And we do points that bring a lot of blood to the ovaries to potentiate those drugs. We like to see you the day before retrieval, because we do points that make Dr. Lucky's job a little easier. We do points that relax the cervix and relax you. So that is important. And then we like to see you before and after transfer. And you will read on the internet that you have to come in immediately before and immediately after, which honestly causes people so much stress, which is the one one thing I don't want you to have on your transfer day. And it's a misreading of a clinical trial. They did that at the clinical trial because it was easier to conduct the trial, to be honest. But we have found at Unova, and we take thousands and thousands of people through IVF, that it's perfectly fine to come in the day before and the day after. So I always tell people, transfer day, just focus on the transfer. Don't schlep around in a taxi in New York attempting to get an acupuncture treatment. Go home, watch Netflix, get someone to bring you tea, put your feet up. And then in a sort of calm and orderly fashion the next day, you can come and see us. And what we do at that point is we do an acupuncture treatment that appears to stop the uterus from spasming. And Lucky will tell you that when they transfer an embryo, the uterus kind of clenches against all this excitement. And they give steroids and anti-inflammatories and things like that to combat it. But it turns out that acupuncture just makes it relax and it doesn't seem to go back. And that is one of the reasons it's so helpful. But we have some time before implantation to do that, even after you've had your transfer. So you can come in and see us the next day and you'll be absolutely fine. So I'm glad you asked that.
What about patients who have thin linings? Because I've had a fair number that I've sent your way. And they definitely, anecdotally, I see a difference in how easy it is to thicken their lining. In prior cycles, when they didn't use acupuncture, maybe, you know, we struggled with it a little bit more. So what would you recommend for those patients?
If your doctor's telling you you have a thin lining, in the run-up, we have herbs that are very good at increasing microcirculation to the uterus, in the uterus. And they're not particularly estrogenic, which would normally be the way you'd thicken a uterine lining with pharmaceuticals. So they're very safe to take just before an IVF. And so we would do that before a frozen embryo transfer, for instance. We wouldn't give them with the stim drugs because that starts to make everything very complicated for the doctor. And then acupuncture, it would appear, also improves blood circulation to the uterus. And I always think that, you know, as I said in the beginning, that one of the things that Chinese medicine does is it sort of prompts your body's intelligence. It sort of gives your body a little prompt. And your body does actually know what to do. And often it's not so much a thin uterine lining, but a not thick enough one at the right time. It's about synchronization. And acupuncture seems to be incredible for that kind of synchronization. So I would say if your doctor says you have a thin lining, come on in and see us. We're very experienced at doing that at Unova. That's one of the things that we treat a lot. But also get plenty of protein. Because that makes
a lot of sense to me, though, because we're already giving you know, dosages of estrogen. And sometimes when someone has a known thin lining, we don't just give them the estrogen pills, we give them the patch or injections. So it makes sense that whatever mechanism, you know, the herbs and acupuncture are working by are outside of that estrogen pathway. That makes sense to me.
And I always teach my team, and I teach gynecology and obstetrics at the doctoral level, and I teach my students this too. We shouldn't be replicating what the doctor does. Do you know what I mean? You need to understand what they're doing and then do something supportive. We're not just going to do the herbal equivalent, because if Dr. Lucky is already giving estrogen, it doesn't help if we give estrogenic herbs. In fact, it could harm. And so what the best intervention we can then make is to improve microcirculation in the uterus. And we know how to do that. Good question.
That was really interesting. We had another question from someone from our social media that wanted to know both of your opinions and feelings towards trying to conceive during this current pandemic.
Oh, good question. Well, I'm going to, Lucky and I were talking about this before everybody gathered. So I'm going to defer to her first on this because she had some heartfelt views.
So I've been spending a lot of the last 2 months talking about this with my patients, both current and new patients that we've been seeing mostly by telemedicine. And it's a real concern because when you look so first of all, this is a novel virus, right? Everyone was calling it the novel coronavirus, but it is truly novel. This is something we don't have vast amounts of research and data on. And anytime there's something new, and that is put next to the question of pregnancy, It causes a lot of anxiety, especially in light of the fact that when you think about other examples of respiratory viruses, something like influenza, we know that there's a definite link between having influenza in pregnancy and having worse outcomes or higher risks of hospitalization, and even higher mortality rates, both in children and pregnant women compared to the general population. So first and foremost, my main concern 2 months ago when we were at this early stage of the pandemic and still gathering data was the safety of my patients, right? I don't want to be actively facilitating pregnancy if it's going to sensitize them or put them in a more vulnerable position. And then the second part of the concern is, you know, the fetal health and the health of any children that are born during this pandemic or conceived during the pandemic. So far over the last 2 months, unfortunately, New York City becoming the epicenter, we've gathered tons of data, and I've been in constant communication with my OBGYN colleagues at Mount Sinai, Columbia, all of the major centers in New York City. And we are seeing very reassuring information about maternal health. We're seeing a very similar breakdown in versus severe cases in both pregnant women versus non-pregnant. So the majority of patients in a study that just came out of Columbia New York Presbyterian, there was about 86% of the positive COVID swabs on the pregnant patients that resulted in no symptoms or very mild symptoms that could be managed from home. And a small minority of patients had more severe illness that required hospitalization. Less than 5% required ICU level care. And these were women that had underlying risk factors. So this information may not apply to pregnant women who have high risk issues like high blood pressure, kidney disease, or cardiovascular issues. But for, you know, the general pregnant population that doesn't have those high risk issues, the data is very reassuring that it is safe for you to get pregnant at this time, and it doesn't seem to put you in a worse off position. Now, the data on pregnancy and fetal health is also very reassuring. We have yet to see any red flags or patterns emerging to suggest there's an increased risk of miscarriage, birth defects. This is not like Zika, which is a very scary, frightening virus where we saw very early on it was associated with a specific type of birth defect. So we haven't seen that. And we have a lot of data that's very complete now on women in the third trimester, so later in the pregnancies when they catch COVID. And those babies have been delivered and tested and by and large are doing great. And there's very, very little data to suggest that this virus can easily cross the placenta. Most large-scale studies that we have so far aren't showing that you can isolate the virus from the placenta, cord blood, amniotic fluid, and breast milk. So, you know, we're still gathering data and being vigilant, but right now we've all come to a point where we feel like it's okay to try to conceive during this time. And you also have to look at the bigger picture, right? When is this pandemic going to be over? Probably 1 to 2 years. Who can really say? But unless we have a good, compelling reason to tell people to put their family building plans on hold for that duration of time, you know, we right now have data or justification. So, so far good news, but obviously we'll keep you posted as we learn more.
Thank you. That was a very complete answer. And I think you reassure people a lot with that. I know when this all started, I too had all those questions of, well, what does this mean for our patients? And it is reassuring as time has gone on and we've gathered the information, because I think for lots of people, this is a good time to try to have a baby. If you've, you know, been forced to create some kind of career pause during all this, you may as well start your family, I think. And a lot of my patients are saying that, well, now I'm working from home and you know, it'd be easy to be pregnant and et cetera, and so I too am reassured. It's one of the reasons we're going back and, you know, helping people get pregnant. And you're right, it's going to go on for a long time, so we have to learn how to live with this and take care of our patients, pregnant and otherwise, with this in the background, I think. But that is reassuring. Thank you.
And I've actually heard that from a lot of my patients, even the ones that aren't trying to conceive, but you know, consulted with me earlier in the year about doing egg freezing or something in the way of fertility preservation. And then now a lot of them are saying, oh, I usually travel for work, but this is now an opportune time because I'm actually in New York and have a flexible schedule. And I feel really not stressed out, you know, trying to navigate doing this and fitting it into my work schedule. So I've heard that from a lot of patients. And we did take a pause on fertility treatments for about 4 to 6 weeks when we were in that initial phase of not really knowing enough. But because of all of the major societies and all of the experts that we're talking to not having concerns about breastfeeding, we've now opened up our operations again, and we're starting to do cycles again. So a lot of patients are using this opportunity to not only do fertility treatments or trying at home on their own, but also to preserve their fertility.
Good question, Emma.
Thank you. I wanted to remind people that you can put questions in the chat box and I can read them out for you if you'd like. We got another question privately. Someone wanted to know if having fibroids, if that could impact their chances of conceiving.
Well, I'll go first because Lucky has a lot more to say. But the answer is yes and no. It depends where the fibroid is, and it needs to be assessed by someone like Lucky here, in fact. But sometimes it can. And there are often, I often send patients to doctors who have fibroids to be assessed for surgery because although you will find acupuncturists who tell you that they can make fibroids magically disappear, I have not seen that, and I've done this a long time and I've taught a long time. We can sometimes shrink them, which is helpful for the people with bleeding fibroids, but if you want to get pregnant, the important thing is their placement in the uterus and whether they're going to affect implantation. And so Lucky will have a bit more to say about that, I imagine.
Yeah, so the main thing we need to do to get an assessment would be a physical exam, but most importantly an ultrasound, because that's going to allow us to actually visualize where the fibroids are. And when you think of the uterus, it's actually a thick muscular wall. And so you think of it in 3 different components or layers. The outer wall is called the serosa, and that's kind of like the skin. And if there's fibroids in that outer wall, it really shouldn't impact your fertility unless they're huge and it's big enough to be causing some sort of mechanical obstruction, of the fallopian tube or something like that, but that would be rare. And then you can have the fibroids that are in the inner muscle. Those are called intramuscular fibroids. Those have not been shown to impact fertility unless they're very large, at least 5 centimeters or greater in size, is what's suggested by some studies. But the ones that we really worry about are called submucosal fibroids. Those are the ones on the inner lining, and that is intimately connected or impacting the endometrium, and that's the surface area that an embryo has to implant into. And so anytime you have something that's mechanically sitting there in that inner lining, whether it's a polyp or a fibroid or even scar tissue, it might take away from the surface area of where an embryo would want to implant, and it may reduce your chance of fertility. The ones that are on the inner lining tend to be associated with the heavy periods, but that's not always the pattern that we see. The good news is if there's something that's just a discrete lesion or fibroid on the inner lining, it's usually an easier one to remove because we can go with a long, thin camera through the cervix into the uterus and just gently scoop it out and get it out of the cavity. But I'd be interested to hear Jill's perspective on just managing the heavy bleeding and sometimes the cramping that is associated with fibroids and how acupuncture can help with that.
We have a very good article on self-help for fibroids on the Inova blog. And those of you, if you haven't been to the Inova Center blog, we've been blogging since 2005. So in our time, we have covered everything. We even have a blog, do we not, Emma, on with Pantone colors so that you can assess the color of your period and see see what's normal and what's a red flag, so to speak. So we do have a good self-help article that's pretty comprehensive. I say that because I wrote it many years ago. But we can help bleeding fibroids quite a lot. We have a category of herbs in Chinese medicine that are called hemostatic herbs, and we have some that are specifically for uterine bleeding, believe it or not. So we don't use those as an alternative to sending you to your doctor because we want your fibroids assessed. But if that very heavy bleeding is causing you problems, which heavy bleeding does, then we can slow that down to a normal rate. And this is another area where I think estrogen disrupting hormones in household products and things. Emma put the link to the blog in the chat. Oh, you're so efficient. Thank you. It's an important discussion to have, because I always say to people with fibroids, the first thing we should do is look after your liver. You know, one of your liver's responsibilities is the reuptake of excess estrogen. And so people with sludgy livers, that's not a technical term, but I often talk about sludgy livers. We all get sludgy livers, I think, or a lot of us, often have trouble with estrogen reuptake and end up with too much estrogen in their system in relation to progesterone. That's also true of people who are constipated, because your body pulls estrogen out of the stool again as it sits there. If it sits there too long, you end up with estrogen, a bit of estrogen dominance, and that can all make fibroids worse. So the first thing I do with a patient is make sure that I have their bowels moving nicely and their digestion working, make sure that I've done things to support their liver function, and then we do a good old clear out of their cupboards at home and get some of these more toxic chemicals out of their house. And I think that's very helpful. Exercise is also very helpful for fibroids. So, getting your blood moving is helpful. And the way I explain it to patients, it's not just aerobic exercise is good for your heart, which obviously it is, but all your organs have blood flowing through them. So getting blood moving actually cleans out all your organs a little bit and gives them all a workout, including your liver. And so, which nobody ever thinks about. They don't think, well, I'm running to pump blood through my liver, but it is actually really important. So that's my advice, but there's plenty more in that article on the blog.
That's great. That's super helpful. Someone else wanted to know if you had any advice on how they could optimize their fertility from home.
Oh, do we, having done all this?
Yeah, we've talked about some of the things like diet. And also I think it's important to acknowledge, and I was joking with a lot of my patients this week when I was taking their history and talking to them about their lifestyle. I said pre-quarantine, because there's no judgment here. I think all of us have struggled a little bit with this lifestyle change. But outside of that, and as we kind of figure out our new normal, regular exercise, some of the dietary changes that we talked about, and I think also doing an overhaul of the things that we're exposed to. Those are some of the ways that we can be working on our fertility while we're at home, but also telemedicine, right? We're both, Unova and RMA of New York are seeing patients and reaching out to patients via Zoom and phone call, and I'm very accessible, maybe even more accessible, because there's less of a barrier geographically. So I'm reaching patients, that are out of town right now, where normally they'd be waiting for their appointment to come back to New York to see me. So I think initiating conversations with, different professionals that could help you. And, a lot of people who are starting the conversation with me now make assumptions that, they can't do any testing, but there's some testing that can be done from home. We offer things like genetic testing to couples to do kind of a risk assessment to see if there's any risk that their genes could match up to, produce a child with any sort of disease later in life. That type of assessment can be done with a saliva kit that we can mail to you. And, we're able to have patients drop in a really safe manner for a designated appointment slot where they're the only patient in the office, and they're coming in for a quick blood draw, and then I get the results and I review them in a telemedicine follow-up consult. So a lot of patients who are self-isolating at home and not really leaving their house for any reason are still initiating their fertility workup and getting the conversation going so that they can hit the ground running once they feel comfortable to leave their house and initiate treatment.
Well, we have been doing virtual fertility coaching and herbal medicine online, and it's proved extremely popular. And one of the things that I realized people needed was some sense of community as well. So we have launched coaching groups. We have our second one starting on the 26th that are a combination of coaching and support. And the group leaders are going to take people through a 3-month program from my book, Making Babies. And they're very experienced practitioners of Chinese medicine. Medicine. Emma is putting the link up there. And so they will meet once a week with the group. We kept that at a very nominal rate. It's 8 sessions for $300, and we give you a free one-on-one virtual consult as part of that. So what we wanted wasn't, we wanted just reach as many people as possible, but we keep the group really small, like 15 people, so they're very bonded by the end of it. And so you get an element of support from women going through the same thing, but you also get helpful advice and a curriculum so that you're working through everything from cleaning out your cupboards to what position to have sex in, to how to know when you're ovulating, what if you don't have cervical mucus, all the things that people ask. And we, like you, are finding we have so much to help people with, and we don't necessarily always impart this knowledge. The patients don't necessarily always ask when they're coming into the office, and we don't necessarily think to tell them. And so our virtual consults, I think, will always be with us now, because we realize that concentrated time on Zoom is really valuable. People get to share their worries, we get to reassure them. It's like doing this, but one-on-one with people's questions. So there's a lot you can do. And you can also just go do the 3-month program in Making Babies. You take a quiz at unovacenter.com and you find your fertility type. And what Dr. David and I tried to do was create 5 buckets of people who require different types of treatment. So for instance, the people who are estrogen dominant require different treatment from the people who have very low estrogen, who again require different treatment from the people with PCOS. So we devised a quiz to divide people into 5 types, and we gave you a program for your type. And that's, lots of my patients are following that program at the moment. It's a good time to do it while you're at home and you can control your environment.
Thank you, Emma. With people being at home, they have more time to be mindful. Yes. A lot more of my patients are providing me during the consultation with more detailed information about how their cycle has, been progressing over the past 6 months. Whereas I think with the way life was 2 to 3 months ago, it was, fast paced. And I think people usually omit certain details with their history taking. And some of those things are really relevant in putting the puzzle pieces together to understand what's going on.
I'm having a lot of my patients take a basal body temperature chart, which we can get a lot of information from, and they just didn't have time before. So a lot of people have used this time to take BBTs, and I have discovered things that are going on, minute hormonal issues that I had not seen in clinic until they did a BBT. I noticed that they surge and then they take a long time to ovulate, for instance, or I noticed that they surge and then they ovulate and their progesterone sustains for a couple of days and then goes down and then comes back up, and I can see that on the chart, and I can give them herbs to correct that. But they didn't have time to do a BBT chart when they were rushing out of bed to go to the gym before work, and now they do. So some blessings in all of this. Mm-hmm. We have a question in the chat about Eastern medicine and male factor infertility. And yes, we treat male factor infertility at Unova. RMA do too. They have a lovely urologist, and my husband is the group clinic director at Unova, and one of his specialties is male infertility. So there is much we can do. And one of the things I like about treating male infertility is that the semen analysis is a very good way of measuring progress. Men make new sperm every day, which come into fruition in 72 days. And so, in 3 months, you can see where you've got. And we have different herbal formulas for motility and morphology and semen count and volume, sperm count and volume. And so we've got a lot we can offer in conjunction with a urologist. We often see people who we then refer because they have things like testicular varicoceles and things like that, which do need assessing by a urologist. But between us, there's much that can be done, and men can really change their reproductive reality in 6 months in a way that's harder for women to do, because they make these new sperm so they can start again. So all the lifestyle things we've been talking about are equally as important for men. And all sorts of things like, not taking hot baths or keeping your computer on your laptop on your lap and letting it overheat, which is a biggie, and keeping your cell phone away from your pocket on your hip. which is another one. So there's much that Eastern medicine can do, and there is a whole specialty in Chinese andrology, and that is part of UNOVA. Not my specialty necessarily, but no.
And all of that is very well supported by data coming from the Western medicine side of things. There's tons of research and data looking at the effect of free radicals and oxidants on male sperm health, and the use of antioxidants to neutralize the free radicals. So free radicals can come from our diet, cigarette smoking, all the things that we know are not good for male reproductive health. So I think that it's something that's well supported by both the Eastern and Western side.
We have another question, which was, and I feel like we might be wrapping up soon, so if you have more questions, definitely feel free to put them in the chat box. But in the meantime, someone wanted to know if there was any advice on how to boost their ovarian reserve.
Well, I'll go first because Dr. Lucky again has much to say. And I will just say that you will find lots of misleading information out there about boosting your ovarian reserve, all sorts of promises on the internet that I want to say that if you have low ovarian reserve, to start with, that doesn't mean you won't have a baby necessarily. You will have good eggs in there, and we just have to find them. But we also have to help every egg live up to its potential. It's not a question of reversing DNA damage in damaged eggs as much as helping your good eggs be even better and live up to their potential. And so stopping smoking is a biggie, and you should tell us, and we won't judge you at all. We're not remotely sanctimonious, but we will help you. And a very healthy lifestyle. And we do have herbs that support the ovarian follicles and support eggs. And I just want to be careful not to overstate their value, because I see that happen. They don't sort of change the destiny of eggs that have already been damaged, but we can help you maximize the potential of the rest of them. And I also believe, and this is a bit anecdotal and a belief rather than a fact, I believe healthy bodies choose as a lead follicle a good egg. That's part of your body's intelligence. And so the more we can support your body to be aware at that very cellular level, I think the more chance there is. But I don't want to sort of overstate it. Oh, and I actually want to say something that I'd be interested in Lucky's opinion on, which is one of the things that patients sometimes take for poor egg reserve is DHEA. Mm-hmm. And I have seen that go either way. I've seen the research on it, and then I've seen people who seem to have really quite extreme side effects from it. Mm-hmm. And my worry about it, we don't prescribe DHEA at UNOVA because we tell people it should be prescribed by their doctor, but you can buy it over the counter in health food stores. So I worry that people who already have high DHEA and don't know it are just taking it. And I wonder what you thought about egg reserve and DHEA, Lucky.
So I think we see very eye to eye on the issue. Like you said, there's a lot of misinformation out there. The $1 million question I always am asked, and all researchers are looking into and have been for years, is there a way to get more eggs to be recruited into the surface of the ovary and available to treatments? And how do we get around this issue besides freezing eggs for future use? The fact that we're always losing eggs over time and we can't, to our knowledge, make new ones. So, I think it's important to distinguish the issue of quantity versus quality. I have a lot of fairly young patients in their early to mid 30s who, for whatever reason, had their AMH level checked, and that's a blood test that tells you about how many eggs you have in a relative sense. And they'll find a really low level and be panicked that now they're going to go into early menopause, or they are going to be, they have fertility issues before they've even started trying. And I very clearly explained to them that I understand their concern, but it's really not a numbers game. When you're just trying on your own, you're ovulating one egg. So whether you have 10 million eggs stored up in the ovary or only, 1,000, it's not going to impact whether that egg that you ovulate each month is high quality and is going to result in an embryo that actually implants and results in a healthy pregnancy. So that is an issue of quality, and that's a whole different topic, but we know that age is a major factor that dictates egg quality, but there aren't really tests that can tell you about an individual's egg quality, and that's a major drawback in our field, and something that we can improve upon and hopefully develop some sort of individualized test. Now, in terms of egg quantity and how we can try to influence it, you can definitely see that there's a relationship between someone's egg quantity and their responsiveness to treatment. They tend to go hand in hand. So if someone's undergoing IVF and we're stimulating their ovaries and they have a low number, it's almost like a double whammy because they tend to have a harder time responding to the medications to even get the few eggs that they have to grow. And there's been some interesting research and data on coenzyme Q10, and it's been studied at dosages of 600 milligrams per day in older women with diminished ovarian reserve as a way to potentially boost their response to treatment. And it's shown some promising results. I think it's not definitive, but it's not a harmful thing to take. And that's the main takeaway, right? It's something that's known to be good for your heart health as a supplement. So I always say if, there's really no potential harm and there could be a potential benefit, why not? With DHEA, I worry about the potential harms because there can be some adverse consequences, effects on the liver. DHEA is an androgen that is produced in the adrenal glands. And we all have a fine balance of male and female type hormones in our system. And there are some women in particular, like those with polycystic ovary syndrome, that have an overdrive. They tend to have a natural overdrive of male hormone in their system. So taking DHEA is probably not going to be helpful to them. And I think the studies out there are not convincing about DHEA in older women with lower egg counts. And, it's not therefore backed by the American Society for Reproductive Medicine. Really smart people that have done systematic reviews and looked at all of the literature critically are saying that there isn't enough evidence to support its use. I have a lot of patients, because you said it, it's over the counter. I have a lot of patients that come to me already on it. And some of them are having some of the side effects that are associated with having an overdrive of male hormone. So I will oftentimes tell them to get off of it so they can kind of have a bit of a cleanse because you never know how different hormones are going to interact and, potentially interrupt what we're trying to do on the Western medicine side of things.
And as you can see, Dr. Lucky and I are often in one voice, which is nice. I love working with you and I love looking after your patients for that reason. I'm the same about CoQ10. I think that can only help your heart, and there is evidence now of its effect on mitochondrial activity, and it looks like a good thing to do. We sell a CoQ10 at Unova. We just don't stock DHEA because I have reservations. I think it might be good for some people, but I think people should talk to their doctors. Well, that was fun.
We have one more question.
Sure.
Someone was wondering, their husband, I'm just going to read it out loud. My husband occasionally dabbles with marijuana, and we were trying to figure out how detrimental it is pre-conception for 1, sperm quality, and 2, health of child. Of course, he's more than willing to give it up. What are your thoughts?
Do you want to go first, Becky?
Yeah, sure. So there has been some initial data. Our experience looking, doing actual well-designed trials is limited. Even though marijuana has been around for a while, I think that people have only really looked at it in medicine more recently in a formal way. There are some preliminary reports that really heavy usage of marijuana can change the hormonal environment in men, and it can lower testosterone levels. And when you have lower testosterone levels, that usually doesn't promote healthy sperm development. The good news for men is if they are, doing anything in their lifestyle that translates into toxic effects on the sperm and they have an abnormal semen analysis, there's always room for improvement, right? Because as Jill mentioned, we're always making, men are always making new sperm, and every sperm has like a 72-day life cycle. So if you have an abnormal semen analysis and there's something you can identify in your lifestyle as a room for improvement, you could definitely eliminate it and see if it makes a difference. There isn't a lot of data looking at light to moderate use, so I can't really comment on it. But I think the first step is, if you're concerned, get an analysis. It's an easy test to do. And if there's something abnormal, talk to your physician about it and maybe start trying to eliminate certain factors that might be at play. In terms of the health of future children, there isn't a lot of robust data. There's some data actually coming from one of the researchers at Mount Sinai. Her name's Yasmin Hurd, and she's actually specifically looking into whether there are transgenerational effects. If you have a male partner smoking marijuana and being exposed to that, and what that means for the sperm DNA, and if that can translate into anything in future. So I think the jury's still out, but it's definitely being looked at and researched actively.
And I would agree when it comes to heavy marijuana use. Anecdotally, and this is anecdotally, I found that men who have relatively light marijuana use, when they have their semen analysis done, there doesn't seem to be a problem. And it seems probably better in some ways than alcohol, where heavy alcohol use in men really does affect their hormones very noticeably and affects their semen analysis. So a little bit of light pot smoking, I suspect, is not a big deal. But as you clean up all your habits, because you're going to be a parent, that might be one that you clean up to. And just speaking as a parent, there's a point at which teaching your children that they can medicate themselves out of emotional states instead of moving themselves through emotional states is not necessarily the best thing. And, you know, when you start out with this little person, you start to think, how am I going to bring up a very functional grown-up person? And those things start to concern you. So it might be the time to sort of knock it on the head anyway. But I don't think a little bit of pot smoking seems to affect what we can see in the semen analysis. Although Lucky's point about DNA fragmentation and things like that, that's just stuff we can't see, and there could well be a risk.
Very interesting. I think those are all of our questions, unless anyone has any last minute questions, but I think that is everything.
Well, that has been an hour, so I think that is, there's a question in the Q&A. Have you looked at that? Oh, yes, you have. Ever efficient, Emma. I would just like to thank Lucky for spending this time. It's a joy to see you from a distance. At some point, I'll come back and see you in the office.
Well, thanks for having me. I really appreciate, everything you do for our patients. And I agree that we have a very symbiotic relationship. So
yeah, we like to work together. I would just like to remind people listening in that Unova has a new coaching group starting on the 26th, led by Kimberly Kelly and Amanda Silva, both very, very experienced practitioners of Chinese medicine. So it's a really good chance to pick their brains. Emma is putting the link up there in the chat. And we're all available for virtual wellness consultations and fertility coaching, and also back in the office next week. So for those of you who need us around your IVFs, we're back at work, which we're thrilled to be back with the patients. And we're clear that, having taken a pause and really thought it through, a bit like RMA, we now know how to deliver our service safely in the time of COVID.
And I'm actually going to leave my email address at the bottom in the chat right now. So if anyone has any fertility related questions that they didn't feel comfortable asking right now in the discussion, or if something comes to mind after the meeting's over, please don't hesitate to reach out.
Lovely. Well, thank you for listening in, and thank you guys. Thank you, Emma, for facilitating this, and Amanda from RMA. And I will see you next time I see you, Lucky. I hope it's in the office.
Yes, me too. Take care, everyone.
Bye, guys. Bye.
Bye.